Hello and welcome to this initial learning video that is part of building trust and empathy around COVID-19 training module for healthcare workers. In this session, we will focus on the important role of healthcare workers and the power of their recommendations in promoting health and specifically COVID-19 vaccines. There is no COVID-19 response or healthcare delivery without you. You are critical to our communities. Healthcare workers are at high risk of experiencing stress and fatigue. COVID-19 has brought on additional stress and psychological trauma. This can lead to fatigue, which is a state of mental, emotional, or physical exhaustion resulting from various stressors. In the same way that a car needs fuel to drive, you need to look after yourself and keep your tank full so you can keep going. Helping in the COVID-19 response is a long-distance race, not a sprint. So, pay attention daily to your well-being, especially since our communities do what we do, not just what we say. Model the behaviors that we want to see. This starts with self-awareness. Self-awareness is the ability to recognize that you're separate from other people, while also assessing your own thoughts, feelings, and beliefs. You're human, just like everyone else, and have feelings. So, acknowledge and accept your feelings. Maintain your own self-care by staying in touch with your personal network, nurturing your spirituality, and taking care of your basic physical needs. Taking care of yourself is important for your physical and mental health. It can also help you take better care of those around you. Patients look up to healthcare workers, and their recommendations can positively influence patients' adoption of behaviors that can keep them safe and healthy, such as getting vaccinated for COVID-19. The decision to get vaccinated is personal, and as healthcare workers, our goal is to provide each patient with information they need to make an informed decision. Optimal patient-provider conversations start with listening. Patient confidence in vaccines has been shown to increase significantly when they receive clear and compelling information from healthcare providers. It is important to use interpersonal communication techniques, such as asking open-ended and probing questions while you listen actively. This will enable you to understand underlying concerns and questions your clients may have, including how each person thinks and feels about COVID-19 vaccination. In addition, you need to always convey empathy by walking in the client's shoes or imagine yourself in your client's situation to build trust. Focus the conversation on the disease itself and away from myths and misconceptions by providing accurate information based on the latest science. And finally, always end the conversation with a plan or clear recommendations for next steps. Don't be afraid to share with the patient why you got vaccinated and if you had any initial concerns as well. Let's see how this healthcare worker puts these skills into practice.
My next client worries that the vaccine is not safe and that it was rushed. Let's see if I can help her out. Do you have questions about the COVID-19 vaccination?
Yes. How did they make it so fast? It's like the government is using us as guinea pigs.
I can understand your concerns, and I had questions too before I was vaccinated.
You did?
Yes.
That makes me feel better, but I'm worried that it's not safe.
I'll answer your questions about safety, but it is important to remember that COVID-19 is really dangerous.
But I don't know anyone who got really sick though.
That's great. Unfortunately, 3 of my patients died and many more were hospitalized. I don't want that to happen to you.
But I read that there might be magnets or microchips in the vaccines.
Thanks for reminding me. You had questions about the safety of the vaccines, right?
Yes, I did.
Many people have taken vaccines in Nigeria and worldwide. Studies were done before the vaccines were produced, though. Many people would have died if the vaccines were delayed. I have studied the safety information and I believe that the vaccine is safe and effective.
I see.
So, can I help you make a plan to get vaccinated?
Okay, but I'm still nervous. But I guess it's the right thing to do.
It's okay to be nervous. It's something new. We can vaccinate you here, or should I give you a referral to another vaccination site near you? What do you prefer?
I'll do it here, I guess. I trust you.
That went well. I'm glad she trusted me. You may have noticed, she believed a myth about microchips. It was hard not to tell her she was wrong. But that wouldn't have helped. Instead, I gave her accurate information. Don't argue or debate. Just provide solid information your clients can act on now or later when they are ready.
Great! Now that we have seen these skills put into practice, let's think a bit more about the scenario. Consider the following questions. What did the healthcare workers say or do that was positive? What did the healthcare workers say or do that could be improved? How would you respond if you were the healthcare worker in question? As we come to the end of this video, remember that it's important to always be patient, communicate clearly and concisely, be a good listener, be observant, nice, and open to all clients. And how can you ensure that you can do this? It's by first taking care of your well-being, and second, by putting the skills demonstrated in this video into practice.